As we're getting settled, my name is Nick, and I have the pleasure of introducing our panel this afternoon. I've come down to be with this panel because I think this is a particularly important topic for us at Medicine X. The idea of integrative medicine feels very complementary, if you'll pardon the pun, to our values of everyone included in valuing people as a whole person. And this is the exact kind of conversation we want to have here. So just as we begin, thank you all for joining us today. I'll be very brief, and then I'm going to turn it over to this panel and Sangeeta, who's going to help moderate today. So Dr. David Spiegel, and I'm going to be very brief with these intros so we get right to it. Dr. David Spiegel is the chair of psychiatry and behavioral sciences here at Stanford Medicine. His associate chair, excuse me, these things matter, and his Twitter handle is the second one down there. Dr. Jeffrey White, I've learned we are nearly neighbors in the greater DC, Baltimore, Bethesda area. Dr. White is a medical oncologist who's been the director of the Office of Cancer and Complementary and Alternative Medicine at the National Cancer Institute since its inception in October 1998. Dr. Gabriel Lopez is an assistant professor. Did I get the credential right there as well? Assistant Professor of Palliative Medicine, Rehabilitation, and Integrative Medicine at the University of Texas MD Anderson Cancer Center. Victoria, and I want to make sure I get your name right, Maizes, pardon me. Victoria Maizes is the Executive Director of the University of Arizona Center for Integrative Medicine and a Professor of Medicine, Family Medicine, and Public Health. Thank you for joining us. And I have one more bio that came to me electronically, but I bet I can do it from memory. Geri Lynn Baumblatt runs patient experience for Emmi Solutions, which is a patient engagement and education platform, and I believe has some patient experience herself that she brings to this conversation today. Thank you all for joining us.
Thank you so much, everyone, for coming to this panel. We've talked in the last 2-3 days, we've talked so much about quality of life and about all the things we need to take care of ourselves and about including everybody. And this is what I see integrative medicine as. It's a way of us to be able to support ourselves and bring all aspects of our life, the whole person into it. So I'm really looking forward to our conversation. I'm going to, once I grab my, I'm going to tell you a little about how I came to this point, and I would love to get a little bit pulse in the room, a sense of what you are hoping to hear today. Do you have any experience with using integrative medicine, some kind of supportive care, or is this new for you? What kind of questions do you have if somebody wants to share? So we'll try and put that in the conversation. We're having a little bit of a slide mishap, so I'm just going to be talking about the questions. But just want to hear first from the audience what you are hoping to hear, what your experience has been with integrative medicine. Just 1 or 2 lines, 1 or 2 sentences, if anyone would like to share. Okay, great. Well, so let me start by sharing a little bit about my background and how I came to integrative medicine. So I started out as a computer engineer right here in Silicon Valley, and the stress of long hours and work and just a lot of childhood trauma took over, and I started having a lot of chronic health problems. So I got diagnosed with osteoporosis and arthritis and PTSD and anxiety and sleep problems and herniated disc and all of this. And here I was trying to professionally, it's like my world was coming together, and I was putting on this face that I'm okay and I'm doing great, but inside I was just falling apart. I was in pieces, and I was trying to find what can help me. And when I went to my providers, I had got the typical options that we generally do, which is take medications. If I have spinal issues, there was risk of doing spinal surgery. And those were very concerning to me. I wanted to find out what else I could do. And I was very lucky that my provider also referred me for physical therapy, which was very helpful. And from there, I found out about using yoga and about Ayurveda. And I started researching, looking at a lot of journals and figuring out what are the things that can help me? What really works? Is there any proof behind it? And discovered a lot of modalities. So within a matter of few years, I was a nurse. I was an Ayurveda practitioner. I was a yoga teacher. I was a massage therapist. I was a laughter yoga teacher. I ended up learning for myself and collecting all these credentials in the process. And that's when I realized it is about treating the whole person. And that is what integrative medicine is to me, bringing all parts of me and giving me the quality of life that I want. And I think that's what everyone needs. Because as I started talking to my friends and family, I realized that everybody is looking for that. And I discovered the definition of integrative medicine. And since then, it's become my mission and passion to share more about it with everyone so that we can all have the quality of life. We can have choices about what we can do for our health and whether those choices are valid, do they make sense, and bringing our providers into that conversation, bringing research into that conversation, bringing all the healthcare professionals into that conversation, bringing the nurse, bringing the physical therapist, the occupational therapist, the chiropractor, everybody into our team on the same level. So that's why I'm really excited to kick off this panel. So this is my journey, and I want to start with the first topic, which is on what really is integrative medicine. I know many of us know here, but there was a question about, is it really integrative or is it referral? What does that even mean? And there is, there's complementary medicine, there's alternative medicine. There are a lot of questions around those. So let's start by understanding what is integrative medicine, what is it used for, how widely is it used? Dr. White, would you like to?
Sure. Okay, well, I'll start off on the definition. And I think we heard a lot of it, spoken by many of you. I'd say that it's still not a uniformly defined term, and so lots of different definitions are used, but they include often bringing together of modalities. They include often looking at the patient as a whole, so more than just the physiology of the patient, but the psychology and the spiritual elements of the patient. They include, and the aspect of whether or not it is delivered by a single person or a team of people or through a referral process is actually, I don't think, really included in the definition generally. But one of the aspects of what I consider integrative medicine to be is a coordinated care. It's a style of practice. It's coordinated care as opposed to a disjointed kind of random, assortment of things. And complementary approaches would be, generally defined as things that are utilized, along with conventional medicine. So actually, when I talk about specific modalities like acupuncture or music therapy or whatever, I call them complementary therapies instead of integrative therapies, because if you're just talking about that specific modality, I just use that term. And at least that's how I go about the definition. So maybe others want to talk about this as well.
Anyone wants to add to that?
I might add, when we opened our Center for Integrative Medicine here at Stanford in 1998, we initially called it the Complementary Medicine Clinic, but people thought that meant free, so we had to change the name. It's really the sort of collective legacy of traditional care, and that includes herbal treatments, dietary supplements, many manipulations like acupuncture, yoga, and then mind-body techniques like hypnosis and mindfulness. And the fact that they are not better integrated, it reflects in part the sort of prejudice among some traditional physicians about its use, the ridiculous underpayment by health care insurers and our non-health system. By the way, the definition of a Canadian is an American without a gun and with health insurance. And so we have that kind of obstacle as well. But the important thing is that the reason we're here and the reason there is the kind of complementary integrative medicine there is because the people insisted on it. This isn't a profession-driven movement. It's a people-driven, patient-driven movement. Americans spend more out of pocket on integrative care than they do out of pocket on medical care. They make more visits to integrative practitioners than they do to mainstream practitioners. So it's being driven by people wanting help with problems that are not addressed well in mainstream medicine. Chronic disease, chronic pain, they don't go to an acupuncturist for a heart attack. They go for chronic pain, stress, and other problems that we haven't handled well in mainstream medicine.
So just to add a few other thoughts, I would say it's a larger paradigm, and that's why it includes this broader array of people with a broader array of skills, whether it's people who have trained in traditional Chinese medicine or nutritionists or people who are expert in mind-body approaches to stress and other problems. But I also want to say that one of the things I'm proud about integrative medicine is that it's not just looking backwards, which is let's bring these ancient healing systems, Ayurveda or traditional Chinese medicine or homeopathy. It's also moving into the future, which means we think a lot about genomics and we think a lot about people's genetic and epigenetic tendencies to perhaps get certain problems and how we therefore need to individualize care. We think a lot about the microbiome and how whatever's happening in your digestive system may also make it easier or more difficult for you to manage a problem that you have. So it's really integrating cutting-edge science as well. And probably many of you in the room know this, but on average, it takes 18 years for an innovation to be incorporated into medicine. And integrative medicine hopefully brings them in more quickly.
So I'll broaden the definition of integrative medicine to include as well integrative oncology, where integrative oncology is what I practice, and it's specifically the application of integrative medicine to the care of individuals who either personally have cancer or have been touched by cancer in some way. There are more and more areas of medicine that are being very thoughtful of what integrative medicine can bring into their practice. And so now I'm familiar with practices of integrative cardiology, integrative gastroenterology. So really trying to see how these different individual disciplines can benefit from integrative medicine. And each one of these areas has very unique patient populations and very unique needs that really do need some extra careful attention to make sure that these practices are brought in thoughtfully, that there are special considerations to any kind of medicines or blood count changes that these individuals can experience as part of their treatment.
Okay, so I want to move us along. Oh, did you want to ask? Okay, I want to move us along to the next question because I'm hoping to leave last 10-15 minutes for us to have questions from the audience where it'll be more interesting. So then integrative medicine, as you touched on, Dr. Spiegel, it's very commonly used. Actually, 50 to 70% of people are using some form of complementary and integrative medicine. And in fact, they spend about $36 billion per year out of pocket in US alone, 12 billion of those on consults and visits. And this is not including any of the services that are covered by insurance, such as nutrition, physical therapy. So we all know we need it and we are utilizing it. So Geri, what I would like to kick you off and start about is, what do you think are the main reasons that we are using integrative medicine? What are the challenges where you think it's helpful? What are the risks in this area, and what are the problems you're seeing, whether it's related to reimbursement or something else? What are the challenges you're seeing?
Well, I think the last two are related because definitely one of the risks is emptying your pocketbook. A lot of these things aren't covered. I think we all kind of learn different ways to game the system. I have a health savings account, and last year I have a very high deductible, and I met it like in December. And then I got as much care as I could during that time. And I was like, maybe I should actually just be more aggressive with my care. And I got to the point where I was also really frustrated, where I'd go to physical therapy, I'd bounce back out, and then a few months later I'd be back, and I'm like, okay, I need to be more aggressive and get to a point where I don't just keep bouncing back. But it is interesting because different practitioners are doing different, like you're certified in a number of things. So I go to see a massage therapist, but she's not doing massage. So, but it's being billed as massage. And even when I call the office, I say, oh, I'm going to get neurokinetic therapy, and they're like, massage. And I'm like, okay. So I think it's really challenging. And then the benefits, I think, are fairly well known. Clearly, people are going because you're getting stuck with whatever your physicians are offering you. And so once you hit that spot, there's not a lot of downside other than the money, usually, I find, to trying something. Usually the worst possible outcome is nothing happens. But other times you really spend more time with people, so you make a connection with them. And it's not even so much even the initial consult that's longer where they learn more, but because they're spending time working on you, they just learn things about you, and they're like, wait, you play tennis, like why did you not mention that before? That actually is probably affecting X or Y, or just other insights they get into your life that give them really big clues that you don't end up telling your physicians. But then I think the other challenge is that it is, for me, very much not even a referral service, it's a self-referral service. The one time my actual doctor referred me to more integrative therapy, I actually thought that person was kind of a quack, and I did not go back. And I don't know, I was like, I don't know who that was, but I'm not doing that. And they talked to me in very strange language and made a lot of assumptions about my beliefs, and I was very uncomfortable. So I think there's a huge amount of challenges, just like there's finding a doctor, finding reputable integrative practitioners. I used to live in Boulder, and I think I can just say that. And everybody will know there's a huge range of people doing really amazing, great cutting edge stuff, and people, I don't know, doing things where they're saying they're doing angel readings, and I just don't even know what they're talking about. So,
Great. I think you'll have interesting
I said I wasn't going
conversations.
to say anything on this topic, but I figured I thought of something to say. It's about risks, the risk part of it. So I would put this, because we didn't only a little bit talked about evidence in the definition. And so ideally, integrative medicine ought to be based on as high level of evidence as possible. And that's where we really get challenged a lot in this field, is that there's a huge, spectrum of evidence that's associated with many of these things. And so there are lots of dietary supplements that are out there, and I'm an oncologist, and if we talk, we mostly are thinking about integrative medicine for symptom management. And if we think about mind-body approaches and manipulation, that's one kind of risk. But if you think about dietary supplements in people that are getting chemotherapy and radiation therapy, then there's a different level of risk. And often you cannot find real specific evidence to tell you what that risk is. So, and then another challenge is that as many people are using complementary approaches, a large percentage of them are not discussing them with healthcare practitioners. So that there's this phenomenon happening, and there are likely to be opportunities for risk that are just uncovered, or that are not uncovered.
I completely agree with what Dr. White said, but if you compare the whole field of integrative medicine to mainstream medicine, the benefits are rather variable, the risks are relatively low, and the costs are relatively cheap. Unfortunately, the insurers don't pay for it anyway, because they only want to pay for the most expensive, not necessarily the most effective treatment, so more money flows through the insurance pipeline. And the other thing I'd say is you're absolutely right, the comment before, that we're not well integrated into medicine, but consider the standard. Mainstream medicine isn't well integrated. You get referred from one person to another. There's very little coordinated care throughout medicine. So all I'd say is don't hold us to a higher standard than we see in the rest of medicine.
Reimbursement has been brought up as a challenge. I think that's an incredible challenge. There's clearly a double standard. The Affordable Care Act should help that in the United States, and that's because there's a provision in the Affordable Care Act that all licensed professionals are supposed to be covered by insurers. Now, not all parts of the Affordable Care Act have yet been implemented. I'm sure there'll be legal challenges that people will have to bring forward for them to have their acupuncture, for example, if there's licensed acupuncturists in their state, or massage therapy. But over time, that law could actually significantly help. The other thing I would say is that in the United States, we are moving towards paying more attention to prevention, to caring more about prevention. Prevention is an incredibly important part of integrative medicine. We're now paying for counseling for certain kinds of issues that we didn't used to. And many of you are advocates for change. If this is something that's important to you, I would really encourage you to add this, although I did hear about advocacy burnout so in the prior panel. But I would encourage you to think about whether you want to ask your congressional leaders. Major changes have happened in our country. We, with one act of Congress, decided that women had to have 2 days in hospital covered after a normal vaginal delivery. And in a moment, all the insurance companies lined up and did it. Hospice care is another example of beautiful in-home care that was covered by Medicare and then by insurers. So I think that we could advocate to have this kind of care covered, considering how many American citizens really, really want it. I know the situations are somewhat different depending on which country you live in.
Okay, I want to move us to our next question, and to Dr. Lopez. Talking about location of care. So we know integrative medicine is so spread out, and it's practiced in many, many different settings. It is in academia, it's in the little shops that's right around the corner from my house, it's in collaborative settings, it's in complete academic settings. So there are a lot of different ways that it's practiced. So I'd love to hear from you about what you have seen in this area and what you think are the challenges when you have integrative medicine or complementary and alternative medicine so scattered.
Thank you. So I'll speak to the challenges of the different environments where integrative medicine is practiced. I'll start by talking about my specific environment. So my clinic, the Integrative Medicine Center, is at a large academic medical center. This is University of Texas, MD Anderson Cancer Center, a cancer-specific hospital. The practice there is very different than where it would be in the majority of settings across the country. When someone in the hospital, whether it's a nurse or physician, is interested in having one of their patients receive integrative medicine services, they actually place a referral to be seen by one of the physicians in the Integrative Medicine Center. And so anytime that a patient is interested in these practices, the majority of the physicians will actually make that referral directly to us. And so we really keep those services that we provide internal and within the hospital. We have 2 acupuncturists, we have 2 massage therapists, and we have someone that does meditation consultations, we have health psychologist, physical therapist, dietitian. So we have these services available internally, and I will speak to this being something that has allowed those individuals that are the conventional healthcare providers to feel more comfortable with referring to integrative medicine when they know that these services are provided within the institution where they practice. The challenge becomes how do we better, and I'll use the word integrate, with individuals in the community who provide these services as well. And I think that the challenge there is communication and education. One is, if there is an individual in the community who does work with a patient, it's important that that individual make an effort to communicate with that patient's healthcare provider and let them know what they're doing. So the more the healthcare provider knows what the non-conventional or integrative medicine provider is doing, the more they understand what's going on, and then the less I would say out there that practice that they're practicing is for that healthcare practitioner, and eventually that relationship, that communication can lead to the patients really having better care. I'll say that another challenge as well is education of the providers in the community. So what is it that the literature right now shows that can be helped by the individual services that they provide? Whether it's a massage therapist or an acupuncturist, what is it that the medical community, the more conventional medical community, will at least be willing to accept based on what research has shown at the moment. And that is really a very strong way to actually participate more in conventional medical settings and to get the community more involved in providing care to patients that are being in academic medical settings. And so I would say that research is one key way. Participating in research, whether it's in the community or an academic hospital, is one key way of getting sufficient information to support some of these unique practices to then be able to allow them to enter into more mainstream. And so really I would say that it's a challenge to push some of these services as services that should be given to all patients when the research behind some of these practices isn't as strong. So I would say that the way to get a lot of these accepted is to push research in these areas and help them to grow.
Perfect. I think that brings us to our next question as a perfect segue into it. So I want to actually combine the last two areas we were going to touch on, which is on what is the research that's being done in integrative medicine and the challenges, and what do we see and hope to see in the future of integrative medicine. So let's spend a few minutes to talk about that and leave some time for Q&A.
Sure. So there's a tremendous opportunity, but a tremendous challenge. As Dr. White noted, there's a major need for research on both the efficacy of this huge variety of integrative treatments and their mechanisms. Dr. White heads one of the Office of Integrative Oncology at the NCI. There's a National Center for Complementary and Integrative Medicine, which is small but has been very supportive as well. The way I would think of integrative medicine research is that it's bottom-up research. An analogy might be to data mining, which more and more with our computational ability now, rather than discovering new drugs, what they're doing is looking for unexpected effects in drugs that we're using all the time to find new indications for them, which is a very promising new way of doing research. In the same way, we've always sort of doing hypothesis-driven top-down research. But if you think about it, the thousands of years of traditional treatments have collected an array of things that people, for one reason or another, are using. Some of them don't work. Some of them may actually be harmful, but some of them do. And so one particular example is that 2UU, a year ago, won the first Nobel Prize in Physiology or Medicine ever given to China for work on sweet wormwood. She discovered the ingredient in it that actually is the first new effective treatment for malaria in the last century. And so it is entirely possible that there's a lot of other wisdom, along with a lot of other mistakes, in many of the herbal treatments or other treatments that have been used. There's a long tradition of mindfulness-based stress reduction. Hypnosis is the oldest Western conception of a psychotherapy. Some of them may work, some of them may not, but it certainly makes sense to start examining them. And so the kinds of investigations that have been done are effectiveness studies. And for example, hypericum, St. John's wort, has been used for a long time for depression. It actually turns out in the studies that the National Center for Complementary and Integrative Health has funded that it isn't looking like it's a whole lot better than placebo, frankly. Although, you know what, a third of people given antidepressant medications are really getting a placebo response. And so, in fact, it's not surprising that there will be some herbal treatments that may be placebo-driven. On the other hand, there are other treatments that are highly effective. So the bark of the Pacific yew tree was the basis for Taxotere, which is now a mainline chemotherapy agent. And part of the problem for integrative treatments is, as soon as we isolate them, purify them, and decide, they suddenly become a medication, not an herbal treatment, and they're no longer integrative treatments. So we kind of don't get no respect because the good stuff gets declared to be mainstream medicine. Finally, the other thing we're looking at is how do these things work? And there's been a lot of neuroimaging research, for example, on mindfulness, which is a treatment with growing interest around the world, really, showing activation in the left frontal pole that tends to elevate mood in general. We've got data now on hypnosis that it inhibits activity in the anterior cingulate, which is sort of part of our worry network. We call it the salience network in the brain, and you can actually turn down activity there when you put people into a hypnotic state, and it's part of how it works for stress and pain control. And so particularly in an era when we're realizing that some of our mainstream treatments, like the very interesting symposium we had yesterday on opioids, are causing as much trouble as they're solving, it's time for us to do more research on the traditional and novel treatments that are considered alternative or complementary, but really should be integrated into modern healthcare.
Wonderful. Well, so let's get into the questions. So we have some time. I have one question from Twitter. In the meantime, all of you can think of your questions. So the question is, when a patient hears the word integrative medicine, what impressions, ideas, assumptions do they have? Any takers?
I think often people conflate it with alternative medicine. And I think it's really important for everybody in this room to understand that in integrative medicine, we really value the wisdom of conventional Western medicine and the incredible advances that have been made. We just sometimes use a tiered approach where we may not start with the most invasive, most expensive treatment, but rather look at the patient and decide what's perhaps the most natural, least invasive choice for them and use a tiered approach to their treatment.
Well, I should mention Emmi Lee runs a very fine dance therapy program and a platform for disseminating it that we're using here at Stanford. And I think one of the things we're realizing is that a major component of good cancer care is what I call the grandmother effect, doing what your grandmother told you: eat well, sleep well, and get plenty of exercise. And that certainly fits. There's growing evidence that exercise during chemotherapy and after has very positive effects, not only on quality of life, but potentially on disease progression. So clearly we need to do more to integrate. Just, many cancer patients, when they're diagnosed, think cancer is going to kill me, which in half the cases it does not. I don't need to worry about the rest of my health. More women with breast cancer die of heart disease than breast cancer. And that means the things you need to do to keep yourself healthy, you need to keep doing even more when you're being treated for cancer.
Just one other quick answer. We have pharmaceutical detailers. When there's a new drug, they go to every single doctor's office and they say, look at this wonderful new drug. This is how you should prescribe it. These are the results you may get. We don't have lifestyle detailers. When there's wonderful new findings about exercise for increased survival in people who have had cancer, when there's new findings about nutrition and cancer or nutrition and cardiovascular health, when there's new findings about mind-body interventions, nobody goes office to office and says, by the way, this is something that you may want to start incorporating into your practice. At the University of Arizona Center for Integrative Medicine, where I am, we have training programs for health professionals where we do try to teach them all of these new findings so that they can integrate it into their practices. But as a healthcare system, we don't do that routinely.
No, I can definitely speak to what's being done to work with the electronic health record. I can share that there is a great amount of interest in tracking outcomes of different integrative approaches, as well as the benefits of them from the symptom perspective. In our clinic specifically, anyone that actually comes to our clinic answers a specific set of questions that are meant to track how their symptoms are progressing or not, are improving or getting worse, and also looking at quality of life. And so the reason we do that is because as patients have contact with the physician in the clinic and then massage therapists and the acupuncturist, we're able to track what the impact of these different services are on symptoms and quality of life. And that does lend strength to the use of these services. When it comes to therapies, you mentioned marijuana. We do have, for example, as well, a registry where we track patients that are seeking different approaches and then trying to see what we can gather from looking at blood counts, looking at imaging studies, and then trying to get a better idea of which specific treatments might have greater promise for more research. So, so there definitely are efforts, and I can speak that it's not just from our program, but there is a academic consortium for integrative medicine and health that is really a collaboration between academic medical centers in the United States, Canada, and Mexico, and there really are great efforts to try to track outcomes that can become part of the electronic health record.
I think to just speak from my perspective, from a patient or a more general, what I see in integrative medicine, I think what MD Anderson is doing, you're pioneering in that initiative of integrating all aspects of care and the integrative medicine into the EMR. I think what we see in the rest of the country and in general anywhere, it's not being tracked. It's not included. There aren't even fields to include it other than writing a note, which becomes descriptive and is not read. So I think it's wonderful that MD Anderson is doing work in this area, and I hope that there is a way to disseminate this kind of work and to advocate for it to be available to all the centers and to all the healthcare facilities, maybe have some bill or some way of enabling this or making it mandatory in some way, motivating, incentivizing so that it is tracked as part of the care, because these are treatments that we are seeking, that we are benefiting from, and they should be part of the services like what you talked about, Victoria, that if a drug is effective, we go door to door and talk about it. Why are we not doing that for massage or for something that worked for a particular condition? So I think point well taken on that.
Well, I couldn't agree with you more. As a psychiatrist, I've been doing that for more than 4 decades. And we were talking before about how integrative medicine becomes the kind of default referral now from oncology, and because it's hard to send people to a psychiatrist, and so very often people will get, half our patients here are cancer patients, and we deal with a lot of disease-related anxiety and stress. We love doing it. That's part of our job. And I think you're right that a lot of the things that integrative medicine provides is help with coping with the disease, not just symptom management. And that's a great thing, and we should be doing more of it.
Any thoughts from anyone on the panel?
It's a great question. I mean, the National Center for Complementary Integrative Health was started actually because the sort of generic drug companies that made dietary supplements didn't want to pay for the kind of research that big pharma pays for. And it costs between $500 million and $1 billion to bring a new drug to market, so I understand the problem. We definitely need more of that, and we don't have it. And so as more and more patients get to treatment anyway, there will be more pressure to evaluate them, as Dr. White has mentioned. On the other hand, though, and you're the IT guy, so you should know how to get all that information together and get it to us. I'll be waiting for it. Thank you. But in the meantime, you know, one of the advantages of integrative treatments is, and it particularly in academic centers like ours here at Stanford and MD Anderson and UCSF and elsewhere, is that you can try new things because they may not work, but they're not likely to kill you, unlike a lot of other things we do in medicine. So one of the things we can do relatively easily in integrative medicine is try teaching patients self-hypnosis or mindfulness or doing acupuncture. We're not going to harm them, and we might help them. And so you sometimes don't need that much complicated information. You need to know the presenting symptom and that they're not doing well at the moment, and that may be enough to go ahead and implement what we want to do.
Wonderful. I think, Geri, you have.
But I do think the communication problem is even a little bit more complex than that. I mean, my integrative practitioners openly acknowledge they don't know how to talk to each other. They don't speak the same language. So I can ask one practitioner to give me notes for the other, and they just kind of go, well, it won't really help. And when I have brought back notes to my physician, he was like, well, I think your therapist has very good knowledge of anatomy, you know, and didn't really know what else to do with the information. Like they just don't speak the same language, and so it's, even if I collect it, they don't know what to do with it. They don't know how to think about it.
Any thoughts, Victoria or Dr. Lopez?
You raised so many wonderful questions. In terms of the communication, you can teach people to learn different languages, and that's what interprofessional training is about. So for example, at our center we received a HRSA, which is the Health Resources Services Administration, which is actually the group that funds medical education from the residency level on, and nursing education. And anyway, we have a Center for Integrative Primary Health Care, and we have a course that we just launched that's 45 hours in length that goes to any kind of health professional who needs training that you can imagine. And so you begin to develop a common language, a shared language, which doesn't mean it's easy to understand what someone means when they say they have kidney yin deficiency, right? But maybe we can learn to translate that into other words that would be more commonly understood, or a subluxation, what does that mean? So that we can all have a bit more of a shared language. The funding issues, we spend more of our GDP on healthcare than any country in the world. And so if we decide that this kind of care is really a priority, we could fund it. We also have to do the outcomes research to show that we're delivering value. And sadly, PCORI, who is here at this meeting, doesn't actually do the health economics part. They do the patient-centered outcomes research in terms of patient preferences and value, but not the health economics. And we have to have the health economics for this field to grow and be successful.
We'll still be here. We are out of time, but we'll still be here for a few minutes if you have more questions. As you can see from this panel and conversation, integrative medicine is not really integrated. we are just starting that conversation. There are so many different modalities. There are so many tiers. It's still so fragmented, and it's still little pieces of things that we are doing in our life and in a lot of different areas and different ways of furthering this field. I hope this is the start of this conversation, and we continue this conversation further on integrative medicine and on what we continue to do moving forward here at MedX and throughout the year. So thank you so much for coming, for joining this session.